The third basis county revenue allocation stalemate in the Senate could now disable functions of the county governments, and more in the health sector following revelations that county staff across the country have not received their remuneration for 2 months now. The nurses have to this end threatened to go on strike starting Monday next week.
They are being left alone on their own to strike on their own. They are being paid peanuts. And yet when they are struck with COVID-19, COVID-19 is not isolating. It is not saying you are a contract nurse, you are earning 20,000, you are a lab person, you are earning 15,000 or 20,000. We will not strike you, they are going to strike someone earning 100,000. The effect of this infection is equal for everybody. And we are telling the government, work of equal value and equal risk must attract equal remuneration and equal risk allowance. Do not go back to work unless you are assured that you are safe and the government is taking good care of you. So from Monday, it is not business as usual in this country.
Senators on Tuesday, however, denied a cash crisis at the counties, saying 29 billion shillings had been set aside to be disbursed to the counties.
We want to make it clear that it is not true that there will be a crisis in the counties, because they will be able to access 50% of what is due to them based on last year's figures. So we want to tell the media not to promote a narrative that counties will be in a crisis of funds.
How do you say that there's no crisis in the counties when money has not been released for 2 months? When people, employees of counties, have not been paid for 2 months, and you stand up to say that there is no crisis? It is also unfortunate that the nurses union is now saying they call a strike, and they know the problem we are in. So how will the strike sort out the problem at the Senate? Do they want to go to the Senate and stand there?
According to the Council of Governors, though, the impasse could literally bring a halt to the running of all functions in the counties.
Obviously, that money will just go towards paying salaries for 2 months. Disbursement for 1 month, paying salaries for 2 months. Yeah, and that will be the end of it.
Every shilling counts, and that distribution of resources is not about equality, really. There can never be equality in real development terms. Even in a family, when you are all given similar resources or equal resources, the progress by each of the members will be different.
The Union of Nurses argues that healthcare workers have been left to fend for themselves even after sacrificing to give their best at a time when the country was facing a pandemic.
People who reign with impunity. If you can steal a mask that is supposed to save a health worker somewhere, and you have a nurse dying, you have a doctor dying, you have other health workers dying, and you are stealing that mask and you are going to sell, and the only punishment that the government can give you in the Ministry of Health is to transfer you. Honestly, are we serious in this country?
The senators who are attempting to reach a consensus before the next sitting on Tuesday have failed to agree on a formula of allocating money to the counties for a record 7 times. If the cash crisis is not resolved soon, the county's leadership allude that it could relay the war against COVID-19. Giverson Maina, K24 Evening Edition.